Hi, I'm Brinda. I'm a research advocacy and training professional working at the intersection of human rights, identities, and technology. Welcome to my session today on how transgender inclusive are digital identity systems, the impact of data for development on gender justice in India. In today's session, I will be mapping the challenges individuals face due to the binary gendering of identification and data collection processes by both public and private actors in India. I will also be mapping the challenges faced by transgender individuals in procuring identification documents, including digitized identification documents. My talk will focus specifically on transgender persons or individuals who don't identify with the gender of their assigned biological sex at birth. My session will build on the findings from my research study, Gendering of Development Data in India, Beyond the Binary, that I undertook for the Center for Internet and Society India in 2018 as part of the Big Data for Development Network. This study sought to understand the biases of data for development and its impact on transgender persons in India. This study looked at the different data collection initiatives in India to question the inherent assumption that large scale data sets are the best reference points for designing welfare solutions, especially for marginalized groups like the transgender community. So, how transgender inclusive are digital identity systems? What are the impacts of data for development on gender justice in India? Since we are in the middle of a global pandemic, let me begin by throwing some light on the situation of transgender persons in India during this pandemic. In 2020, the living and livelihood conditions of transgender persons in India worsened during the national lockdown owing to the outbreak of COVID 19. Lack of data on transgender persons has often been stated as the reason for the lack of budget allocation and targeted programs to address their needs. However, the problem lies in the inability of transgender persons to enter data systems due to the exclusionary design of these systems. Before we look at the design of these systems, let's take a quick look at the legal developments related to the rights of transgender persons in India. The exclusions faced by transgender persons were expected to end with the passing of the Nalsa versus Union of India verdict in 2014. In this verdict, the Supreme Court of India for the first time recognized the right of every individual to self-identify their gender as male, female or transgender. This verdict further detailed out 9 directives to the central and state governments for the inclusion of transgender persons, a historically marginalized population group in the country. However, these directives were not implemented by all states and the situation continued to remain bleak. Further, despite severe oppositions from the transgender community, the Transgender Persons Protection of Rights Act was passed in 2019. Historically, transgender persons have struggled to enter public systems and databases owing to the lack of a valid identification document in their preferred name and gender. In early 2000s, digitization of data systems was introduced in India, assuming it to be the ideal solution to remove existing offline challenges and enable people-centric systems. However, digitization has replicated the existing challenges for transgender persons with respect to entering data systems. In several cases, digitization has further amplified the complexities involved. The new law passed to protect the rights of transgender persons is in fact likely to discriminate against them, including their access to COVID 19 vaccination. Here's why the challenges of transgender persons in India are likely to persist. Prior to the new Trans Act, there was no standardized process to change one's name and gender on ID documents. This process varied for different ID documents across different Indian states. The rules of the new Act details out a standardized process to change any individual's ID documents. However, this process continues to demand an existing ID document in one's assigned name and gender for both digital and offline processes. It is common for transgender persons to flee their homes due to the stigma, discrimination, and abuse that they face from their natal family for being transgender. While fleeing their home, many do not leave with an ID document, and this impacts their ability to enter data systems and access their constitutional rights, including state sanctioned welfare. Further, accessing private service systems like healthcare, employment, banking, housing, or even education requires verification using a government issued ID document. So, the discrimination and challenges in procuring government issued identification documents then impacts a transgender person's ability to also enter private sector data systems. This in turn impacts their ability to access private sector services. Prior to the passing of the new law, with or without an existing ID document, individuals had to deal with a tedious legal process to change their name and gender on different identification documents. Respondents of my study noted that information on such processes, digital or otherwise, is usually available only to those who are educated or associated with a non-profit organization working with a community. The challenges are far higher for those with neither. This simply means that only those with human assistance can enter these systems. But the ultimate hurdle comes while dealing with the government officials. Respondents noted that not all officials were aware of the NALSA verdict or the paperwork required to change name and gender. The rules of the new law includes an online or digital process to change one's name and gender on identification documents. That said, the tedious legal process continues even with the attempt to standardize the process for name and gender change. Changing one's name and gender in identification documents requires an individual to undergo a two-step verification process. Both steps require an individual to submit an application in the prescribed format to the district magistrate in person or by post till online facilities are developed by the state government concerned. Even prior to passing of the new law, it has been a serious challenge for transgender persons to meet the arbitrary demand for a sex reassignment surgery certificate to change their ID documents. Some states, prior to the new law, some states even had a screening committee to issue transgender identity cards to transgender persons. Often, individuals are subject to horrific human rights violations during this process in order to prove their identity. Medicalization of the ID change process was one of the primary concerns of the transgender community with respect to the new law. Section 7 of the Transgender Persons Protection of Rights Act 2019 requires an individual to undergo sex reassignment surgery in order to change their gender within the binary of male and female. The final rules of the law do not mandate a surgery. However, it still requires an individual to submit a medical certificate. Mandating a medical certificate to verify one's gender identity continues to violate an individual's right to self-identify their gender. Respondents of my study note that digitization did not remove these human right violations. Given the stigma, discrimination, and procedural issues involved, transgender persons have been changing their name and gender on documents with a less tedious process. So, with all these different challenges, how effective then is a digital process to change an ID document? Digitization of the ID change process can remove the stigma and discrimination faced during an offline process. However, the effectiveness of a digital process is questionable given the current state of literacy, digital literacy, and access to internet and smart devices among transgender persons. Due to social stigma, it is significantly difficult for transgender persons to disclose their gender identity in HIV testing centers. Often there is negligence on the part of the hospital or HIV testing center staff with respect to disclosing their identity or HIV status. To avoid being traced, individuals often use different identification documents with different name and gender at different points in this process. Accessing public health care requires the use of Aadhaar, the 12-digit biometric based digital ID in India. In 2015, the linking of Aadhaar was made mandatory to access HIV treatment in the country. Due to apprehensions about their Aadhaar data being breached, after multiple instances of Aadhaar data breach in the country, there have been multiple cases of individuals discontinuing their HIV treatment in several parts of the country. UIDAI, the body responsible for Aadhaar, claims that no profiling of people based on caste, religion, income, health or geography is done using Aadhaar number. However, gender is a mandatory data category to be filled out while enrolling for an Aadhaar. Mandating Aadhaar to access health services, especially HIV treatment, automatically profiles transgender persons a high risk group for HIV. For this reason, among others, transgender persons avoid using public healthcare system for other medical conditions. However, the availability of subsidized HIV medication in the public health system makes it unavoidable for HIV treatment. Further, accessing private health system also requires a government issued ID. Due to heavy dependency on private health system and lower usage of public health system, the big data produced by both private healthcare system and public healthcare system provide insufficient information on transgender persons and hence cannot be used to design health related welfare services to address their needs. Going beyond healthcare, the many social stigma of being transgender has direct implication on the big data generated by private sector service providers. For several reasons, the private sector big data is insufficient to make welfare decisions for transgender persons. To begin with, not all service providers provide a third gender option in their application forms. There is also the dependency of private sector on government issued ID documents, government recorded data, hierarchy among these IDs and data, and the continued misrepresentation of transgender persons in the private sector big data generated by private sector service providers. With all these many problems, what is digitization and a digital ID doing for the inclusion of transgender persons? Is it bridging the existing exclusion gap, or is it creating new challenges along with the replication of the existing problems? Unfortunately, digitization and a digital ID continue to make data a problem to be solved. With or without digitization, the demand for an ID document in a person's given name and assigned gender means the burden of proof continues to remain on the individual even to become eligible to access constitutionally sanctioned human rights. With increased digitization of all systems, it is important to address the challenges faced by a marginalized population group like transgender persons who struggle even to enter these data systems to access their rights. Far from viewing digitization using a digital ID as the universal solution to leave no one behind, there is an urgent need to question the impact of interoperability of data across different data systems for a vulnerable community. Apart from privacy concerns, especially in the absence of a privacy law, interoperability also replicates the existing offline challenges even with digitization. What is the social cost of such interoperability for an already marginalized population group? Multiple documents are necessary for transgender persons to navigate the social stigma associated with their gender identity. Multiplicity of identities gets replicated by digital identification systems. Given the complex challenges faced by transgender persons, disconnected offline data systems made it easier for people to access their rights. The offline data systems across different government agencies allowed individuals to have different terms of engagement with different departments. However, by digitally linking these different data systems, information provided by the same person now appears as a data problem to be solved. In conclusion, it is evident that India's data for development views gender in the binary of male and female. This is only a reflection of the present-day global approach to data for development. The Sustainable Development Goal 5 aims to achieve gender equality and empower all women and girls. Accordingly, the Human Development Indicators and Indices 2018 statistical update released by the UNDP highlights both gender development and gender inequality indices only for male and female population groups in different countries. The report does not include any information on individuals who identify beyond the binary genders of male and female. Globally, gender in development data is seen in the binary genders of male and female. So, the dominant binary gender data conversation is in fact leaving people behind. I conclude building on the work of legal researcher and human rights activist Dr. Usha Ramanathan. Systems that tag, track and profile transgender persons, placing them under surveillance, have consequences beyond the denial of services and enter the arena of criminalizing for being beyond the binary. The vulnerabilities of their gender identity exhibits their threat to freedom. With their freedom threatened, expecting individuals to be true about their identity just to get access to what they were promised by the state goes against the very idea of development and human rights. Thank you.